Hi, my name is Caitlin. I'm a student physical therapist at Carlo. In the pediatric session that I attended at CSM in Houston was called The Strategies to Overcome Roadblocks in Pediatric Aquatic Therapy. The presenter at the conference, so there was only one. Her name was Eileen Deborah Tisser. She's a physical therapist, and she's from Massachusetts, and she is the founder of Swim Angelfish. Some of the most important or impactful things that I had learned during the session I attended includes that there are 9 aquatic therapy goals that include core strengthening, motor planning, bilateral coordination, primitive reflex integration, dynamic balance, postural alignment, mobility, gait training, and respiration when working with children with autism in the pool. Side note about that, most of her clients in Swim Angelfish were mostly children with autism. So regarding that, there are 7 roadblocks to these aquatic therapy goals and include safety, interpreting touch, managing submersion, ways of processing, body and breath control, inability to go on their back, and seeking sensory input. Um, so a couple strategies for each one of these roadblocks include, so for safety, there is reinforcing ritual and routine, waiting, asking permission, encouraging holding, taking side of the pool wall, holding equipment, ability of the child to submerge, and reinforcing the layers of protection. Some strategies for overcoming touch interpretation include so touching equipment, use of physical assistance, fading prompts, using touch to improve understanding of directions, using a regular touch to promote independence, and using sensory input to prepare for submersion. So strategies for successful submersion include long, slow under with streamline, physical assist to prevent neck hyperextension, controlling chin tuck, graded trunk flexion and extension with rotation, pairing neck flexion with resisted trunk flexion, and progressing comfort with face underwater. Um, so strategies for time between directions include client repeats directions to ensure understanding, PECS pictures using the phrase first and then, visual demonstration, and increasing proprioception with equipment for motor planning. Strategies for body and breath control include rolling to back for recovery, floating, time limit, VCs for motor planning and encouragement, head movement to control body, breath and buoyancy roll, and then rollovers, use of equipment, and knees to chest and feet to floor. Next is the roadblock for inability to go on back. So strategies for that include moving head past neutral, including graded support, using movement for self-regulation, flexion and supine for comfort, and then moving into more extension. And the last roadblock includes sensory input. So strategies for that include sensory input to increase tone, adjust hand placement for alignment, core activation, rotary input to help motor planning for bilateral coordination, intermittent sensory input to increase reciprocal motor skills, dynamic standing with active rotation, carry over to gait training, increase ipsilateral upper extremity and lower extremity input, and wrist weights to increase body awareness. Um, so how might this new knowledge impact my future practice? So These strategies will impact my future practice by realizing that they are useful for a variety of diagnoses and not just specifically for autism, such that they can be used for interventions on land as well and may be useful to increase engagement or easier for a pediatric patient to want to participate in therapy sessions. Also, it is useful to have these strategies to refer to when working with a pediatric patient with similar impairments outside of autism. Also, related to aquatic therapy for pediatric patients, this may serve as a valuable intervention in the future, especially if progress is slower or is slower on land or the child likes to be in water. Also, water may be a better treatment option for children with autism in order to address the associated impairments and promote patient safety. So at the exhibit hall, there was a lot of things there, especially regarding pediatric um, interventions, physical therapists, and whatever else. So something that I chose, that I personally like, that I think that would be useful in pediatric patients, is the Bark Park. So every day at the exhibit hall, they brought in different breeds of puppies that we could go in and play with or observe others playing with them. So I think this can be utilized in pediatric practice, specifically through animal-assisted therapy, which can provide tactile stimulation and promote body awareness for children with sensory processing difficulties. Also, animals can provide emotional support to children who may be experiencing anxiety and, or fear by motivating children to want to participate in therapy sessions. By using puppies in therapy sessions and teaching commands, children can begin to develop single and multi-step command sequencing. Is maybe beneficial for, puppies are also learning a bunch of different things when they're young. So, children can use those commands like, teaching a dog how to sit, roll over, they also are learning, the pediatric patient and the puppy can learn commands kind of, simultaneously with each other. Um, and then finally, animals can be used to promote especially endurance, strength, and balance through the patient can walk them on leashes on different terrains, which may help a child if they're having balance difficulties or difficulties with reciprocal gait patterns. So they can change going from walking on a level surface to an uneven or grass to gravel. Um, Playing fetch with animals or dogs. So if the patient has difficulty with upper extremity strength or range of motion, that might provide more engagement for the child, in order to, take care of those impairments. Um, and like I said, with the gait pattern, it can also help with progressing their gait mechanics in an appropriate manner.